everyone. Welcome to this session of Candid Conversations. In our conferences, we tend to discuss only about academics, but there is so much to life and even plastic surgery, which is beyond academics. There are many amongst us who are doing phenomenal work which we are not really aware of. And there is so much to learn about them, so much to learn from them. So, Candid Conversations is an attempt to interview seniors, colleagues, and our inspiring faculty of plastic surgery in India. And I am Nikhil Panse, and welcome to this session of Candid Conversations. I would like to call it Beyond the Knife Candid Conversations. Our today's guest is Dr. Mahesh Prabhu. He is a consultant plastic surgeon at Kolhapur, Maharashtra. All of us at some point or the other have heard him talk about his passion, his experience in surgical volunteering and participation in humanitarian missions. Apart from being an academician, contributed numerous articles and book chapters. He is, as I mentioned, passionate about surgical volunteering. Apart from contributions to surgical camps in India at multiple places, he has been consistently and dedicatedly participating in surgical camps in Gaza, Syria, Yemen, Iraq, Nigeria, China, Cambodia, Vietnam, Uganda, Thailand, Myanmar, Kenya, multiple countries over the past more than 20 years or so. And what is more important is that he has been doing so consistently, almost 4 to 6 weeks per year. So this session is all about learning about his experiences, what he has gained as a plastic surgeon, what he has gained as a human being from these experiences, and also knowing how we all can be a part of this initiative and more. So welcome, sir, to this session of Candid Conversations.
Thank you, Nikhil, for inviting me for this conversation. I'm deeply honored, and thank you very much for inviting me.
Thank you, sir. Sir, can you share with us how your journey in plastic surgery began and how you actually entered into this field of humanitarian work?
Well, I always wanted to be a surgeon. I mean, that was given because I had a role model in our house. My uncle, Dr. K.P. Prabhu, was a very renowned surgeon, and so he was a role model in our family, and so many people in our family have become surgeons following him, including his son. So there was then when I was working with Dr. V.R. Chitale in Cholapur, he was very much interested in plastic surgery, and then I that's how I took up plastic surgery. Then I worked with a lot of senior plastic surgeons like Dr. Antia, Dr. Narendra Pandya, Dr. Keshwani, Dr. Bhuj, and so I had I saw all these people work while working in Bridge Candy and Kambala Hill Hospital in Mumbai, and then I decided that I wanted to do plastic surgery. So I joined the plastic surgery at KM Mumbai, and that's how my journey began. As far as humanitarian things are concerned, I was student of Dr. Goleria and Dr. Rana. After Dr. Goleria retired, I was transferred to Dr. Rana. So Dr. Goleria used to take camps in Dharamshala, so we were aware of these. And then when I went to JJ as an assistant professor, there Dr. Atul Shah and Dr. Swarna Rao madam, we used to go for a lot of leprosy reconstructive surgery camps, and that experience and that whole thing got me into these camps and volunteering. So that's how I actually I got interested in this since a very young age.
Right, sir. Sir, all of us have been part of some of the other camps, mainly in India. But any specific, I would like to say, what was the moment which took you into international volunteering? Because apart from India, I think most of us attend or do take part in camps occasionally, maybe a year or so. But you have been doing so internationally. So how did you go into that?
Yeah, just before that, I have a brief history. Like, our family has a history. I mean, a legacy into volunteering. My wife, Professor Namita, is a granddaughter of Dr. Dwarkanath Kotnis, and Dr. Dwarkanath Kotnis was one of the Indian surgeons who went to China during the Second World War, and he laid down his life. And he is considered as a national hero in China. And because of that, our family, Dr. Kotnis's family, was invited to China as a state guest in 2005, and it was a very memorable experience. So that was one of my first stints abroad, and then we also took part on a medical mission there. But the first major international exposure came when during the I was a part of the Rotary Intercontinental Medicare mission to northernmost part of Uganda called Gulu. Uh, in northern Uganda, there was a civil war going on for 10 years. And when this civil war ended, we were the first group of surgeons, nine Rotarian surgeons, along with UNICEF, Crane Bank, and WHO, went to this northernmost part of Uganda to conduct. Like, I was a plastic surgeon, there was a gynecologist, ophthalmologist, orthopedic surgeons. So there was a big group of Rotarian surgeons. So we went there and did a lot of surgeries, and that was my first experience in international volunteering. And there, actually, I met one of the British surgeons who had come there on his own, and he asked me, how old are you? I was around 44, 45 at that time. And he said, Mahesh, and this guy was about to retire. He was 65, and he was about to retire from NHS. And he said, now I plan to get into volunteering more often, that once that I retire. But he said, since you are young, I would rather suggest you that you continue with this, so that by the time you come till my age, you will become quite senior in the hierarchy of volunteering. And I didn't understand that at that point of time. What does he mean by hierarchy of? But it really matters, because how senior you are, how many missions are behind your back, that matters when uh, when somebody chooses you to be a
Maybe
volunteer.
lead a mission or sort
Yeah,
of.
lead a mission. Yeah, that's exactly. So your past experience counts. So I mean, I took it to heart, and I realized that I should be looking for more and more opportunities. To
Right. So you have worked in surgical missions, surgical camps in India, and I believe maybe more than around 20 countries or so across the globe. So how do you find it is different in India and these countries, maybe culturally, infrastructure wise, convenience and comfort wise, support staff wise?
depends, like, which countries you're going, but most of the times, apart from, I mean, in Gulu and few countries in Africa, most of the places, the hospitals which we work with are fairly reasonably well equipped, uh, and they can be comparable to our public hospitals. Not as good as teaching hospitals, but decent. And on missions, I always carry my critical instruments, including my loop and my, so that I don't get stuck, like my specific scissors and forceps. So, like, I carry my set of surgical instruments and my loops. That has been my, so that I don't get stuck because of this thing. So about a 15, 20 instruments, and wherever I go, that's like, I'm in Kolhapur, like, plastic surgeons are wandering surgeons. You get calls from anywhere, and then you have to move around and do surgeries. So you're used to, I mean, at least I am used to doing that in Kolhapur. So
Right.
it's no different for me, going to these countries and operate. So, like, I carry my set of instruments, even sometimes supplies where I know that I may not be getting some critical. So I even carry my sutures sometimes, and including 2% lignox with adrenaline, which is very important for me because you don't get that concentration. So I
Right.
usually carry even that, and some, I mean, good quality surgical blades, or so that I'm not stuck uh,
I
if
know.
yeah, so that's every single time I've been on missions, I realize that okay, if I have done this, it would have been better next time. So now I make it a
You
point
have
and
your own list to take along with you, what all
yes,
do
yes,
you need to
yes,
carry
yes,
with you.
yes.
And of these countries, excluding India, I mean to say, how would you rate their infrastructure against each other? Maybe African countries versus Cambodia, China.
See, now Cambodia and all are actually coming up. Even in Africa, if you see, uh, there are a lot of equipments which are being. They have a lot of equipments. In fact, even in Gulu, the place where I had gone, that was a French hospital called as a Lechor Hospital. They had pediatric endoscopic sets and the Fogarty catheters all donated, but and so many equipment, like I mean, which would have been good for some 3 4 hospitals, which were
Mm.
donated, like, and nobody was using them. I mean, if you see the junkyard of any African hospital, you will see tons of high end equipment, because what happens is somebody comes and donates these instruments, and anything happens to that, there's no question of repairs or anything till somebody else donates a new
And there is
instrument.
no trained manpower to, I believe, to use those
Yeah,
instruments.
like nobody services those instruments in those countries. So
Yeah.
that is the big problem, and that is actually in fact there was a project by the anesthesia department of Johns Hopkins,
Mm.
wherein they were saying that, like, when you're donating equipments to, especially high end equipments, to Africa or anything, you should be able to give more like Indian kind of instruments. I mean, so that, like,
Maintenance fee.
so everything in one workstation, and if something doesn't happen, that whole workstation is useless.
Right.
While as we have re-engineered stuff, you understand. So we
Right.
can manage with the jugaad, and these machines, even some a power cord doesn't work, the machine doesn't work.
Mm.
So this is the problem, especially where the servicing of these equipments is not good.
Right.
Even places like Gaza, I mean, the hospital, Al Shifa Hospital, where I work, is absolutely top of the line hospital. It was a teaching hospital. It was better than, uh, I mean, 95% of public hospitals in the country.
Oh,
Yeah, yeah. Gaza gets aid probably more than most of the countries. Like, even in Africa, I'm telling you. Like, so as far as the infrastructure in Gaza hospital at that point of time was concerned, was very good.
mm.
Plus, the Médecins Sans Frontières had supported the plastic surgery department, so they had excellent burn unit, very good burn unit. Like, I haven't seen 6 cordless dermatomes working in one unit, I don't think.
Yeah, even my unit doesn't have one.
So 6 cordless dermatomes, working dermatomes.
Yeah.
So and so like sometimes you see them, like it sometimes I feel like Mary Antoinette said, like, if you don't have a bread, eat cake. So this is the situation sometimes, but not always. This is just I'm talking about Gaza, because Gaza is a technically, it gets lot of uh, what do you say, funding from various agencies.
Right.
But unfortunately, now the whole thing is demolished. I don't know if I ever get to go to Gaza again.
Again.
But yeah.
We'll come. I'll specifically ask you about Gaza again. But are there any specific challenges which you encounter while being a part of these surgical missions? By specific challenges, I mean maybe issues with visa, logistical issues, accommodation. Like you said, you need to carry your instruments. So carrying instruments through flight and all these things. Are there any significant logistical issues which need to be considered?
No, so as far as the visa is concerned, the visa is taken care by the agency with which you are working. So, like, if you're going with MSF, they will take care of the visa. Everything is done. The ticketing is done by them. So you go there. but sometimes you definitely get issues regarding visa, because for going to Gaza you have to go via Israel.
Mm.
My first Israel visa took me about 8 weeks, and there is a lot of background check, including two generations from my mother's side and two generations from my father's side,
Oh,
and then the police verification and all these things during. And then I got the visa. Actually, normally you don't get a stamped visa of Israel. You get a what is called as a clip-on visa, so that there is no evidence of you have been traveled in Israel,
oh,
because Israel knows that if you travel to Israel, you can't travel to 40 different Muslim countries,
yeah, yeah.
including Saudi Arabia.
Yes,
So
I was going to ask that.
usually it is called as a stapled visa, but they gave me a stamped proper, 1 year multiple entry visa. So,
Okay.
but it was mentioned in that visa that on invitation of Messages of Frontiers, I had an issue with this visa when I had to go as an examiner in Malaysia, University Sans Malaysia. I was
Oh,
invited, and the Malaysian embassy was not giving me the visa because I had traveled to Israel.
oh,
So then I had to tell them, see, I had to send them the letter that I had been to Israel, not to go to Israel, but I had to go to Gaza, and look at my stamps that I have exited Israel and gone to Gaza and come back
exactly.
multiple times.
Right.
And then after my agent told that this guy has gone to Israel multiple times, not to go to Israel but to go to Gaza, that is
Mm-hmm.
how I got Malaysian visa twice. Otherwise, with that stamped Israeli visa on my passport, I could get I mean, I would have had a real tough time.
Is the reverse true? Like you have been to Gaza, you have been to Palestine. So is it difficult to go to US or get visas
No,
from?
no, no, no.
It's not
I've
like
been
that.
to I've been to US after that. Usually, the, there was never a problem. But there are certain countries, yes, you can have problem while getting the visa.
Yeah,
If
obviously.
once you have a US visa continuously, then probably usually it doesn't, unless you make some objectionable you know social media post or something, which they are monitored.
They are monitored, right?
So, but when you are going just like as a tourist, there is no way anybody has to know like you're going.
Absolutely.
See, only when you apply or renew your visa, then
Only
probably
then the problem
your
comes.
social media accounts and all those things are checked.
Right.
But if you're going as a casual visitor on multiple entry visa, I don't think this matters, because I've been to US many times after I've been to Gaza. So
Hmm.
this was never an issue.
And how risky is it now? Now I believe it is tremendously risky, and I think nothing is going on at this moment in Gaza. But when you had been to these countries, not just Palestine, not just Gaza, but multiple other countries as well, how
Very
risky
different.
is it in the conflict zone for
Not even
so,
conflict zones. Uh, I'll just tell you about Africa. Like in Nigeria, I went for Noma mission thrice. So there, the moment we landed in Abuja, we went to the MSF office. The first thing they did was, got our certifications right, like the permanent temporary medical registration and all those things have to be done. That has to be done for every time. Like, you have to be temporarily registered with that. Even in Gaza, if you have to operate, you have to have a temporary medical license of that country. So
right,
wherever you go, normally that is done. You have to have a good standing certificate from the Medical Council of India. You have to send them, like,
right.
there is no issue with you. So when I landed there, they gave us first thing they did was they gave us $100 note and 10,000 nairas, and they said that this should be always in your wallet.
Ah,
God forbid you are mugged.
okay.
So never spend these $100 and this 10,000 naira. So
So they
if you
should
are
have
mugged or
something to
anything,
take with them.
so you just give it to them, that person. Suppose you don't have, and then that out of frustration, that man might shoot you or just stab
Oh,
you. So you know,
I get it.
if he's fishing into water, then I am the bait. I mean, I catch the bait. So like he has to be satisfied with, otherwise he can get frustrated. And that was told, and this is very true in Nigeria.
Mm.
Of course, you are never allowed to travel alone. There are, everywhere you go in with MSF, especially in dangerous areas, there is something called a security briefing.
Okay.
Very, there is a security briefing. You get a lot of documents beforehand, before you go on these missions. And one of these document is security briefing. I mean, there is a hierarchy where you have to go. So, like, you have to go to, in Nigeria, especially in Sokoto, it was quite dangerous. So we were from MSF house to the hospital. We used to travel in that MSF van,
Yes. Yeah.
which had satellite communication, three different types of communication, and every 20 minutes there had to have a communication between that vehicle and the central, this thing, command,
Okay.
so that they know that, everything is
Everything
fine.
is going on well.
So it so happened that, after, at the end of the mission, we went just for, there was a river and the river front. So just a half day we said we'll go, and it so happened that for 45 minutes our driver forgot to,
Oh.
and there was a big hoo-ha, because there was no communication for 45 minutes. And if that happens, that means either there is an abduction or there is some serious issue. And we really got a, that our driver got a real, this thing. Plus everybody of us were said, I mean, this is not done. We were so worried of you, I mean, you guys.
Yeah, 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 I get
So
it.
like, these people are worried, because abductions of foreigners is very common,
Very common.
because that is one of the way of,
Earning livelihood, I think.
getting ransom. So a
Yes.
lot of these NGO workers are abducted in, in various countries. So, and so we are told that, we have to be very careful, go with the MSA vehicle, and there are security protocols we have to follow.
Yeah,
uh,
yeah.
if you don't follow them, then you are a security risk, and you
Right.
are just, asked to pack your bags and head home, because you are a security risk. And it can become a big international scandal, you understand. A
Yes.
MSF volunteer is abducted, becomes an international news. so,
Absolutely.
so
In your all these years, have you ever encountered this? Have you heard this actually happening to your colleagues, or you being a part of some of these incidents?
Yeah, yeah, yeah. Many of the colleagues have. I mean, MSF has lost a lot of colleagues. There are even couple of colleagues who have been abducted for the last 3-4 years, and people have been negotiating.
Is
This happens in South Sudan. It has happened. So this is not something new. MSF has a manual uh, uh,
what to
on
do in
how to
these
behave
circumstances?
if you're abducted. There is a manual. Then it actually clearly states that how to behave in the first 24 hours. How do you think in first 24 hours? If you're not freed in first 24 hours, then plan for the
Oh,
next 72 hours. If you're not freed in next 72 hours, plan for a week. If you're not freed in 1 week, then plan for a month. And if by the end of 1 month you are still in captivity, then you think that this is a long term thing, and
acha.
then start looking at, feeding yourself well, exercising, keeping ready, yourself ready and fit, so in case you get chance to
Opportunity
escape
to run
the,
off.
uh, or whatever, like, then you are in for a long haul. And there are, I mean, that there is a manual for this,
Oh,
how
so
to
it
how
is
to behave.
genuinely risky.
Pardon?
It is genuinely risky.
And I mean, if you're reasonably alert, and it
Following
doesn't happen
protocols, then I think
unless you try to be over smart. It doesn't happen. I mean,
right.
unless there is a big ambush, and you know uh,
Yeah,
these things are not very common. These things are not very common.
but
It's
they
not a
tend
very
to
dangerous
happen. Do
thing.
happen.
But yeah, yeah, you can get caught in crossfire. I mean, I mean, that's really
Unfortunately,
unfortunate. But I mean, is it so dangerous? I wouldn't say so.
Okay. You talked about the Africans giving you $100 to keep it just in case you are mugged. But apart from that, are there any financial incentives or financial remunerations of being a part of these missions?
Yes, you get something called per diem in the
Something
local
called
currency. Per diem, per, PADA, sir,
per diem. Per
per
diem.
diem.
Okay, okay,
So
okay.
per diem is you get per diem in the local currency, so
Achha.
that because you are supposed to the when you are working in the hospital, the food is provided by the hospital authorities or whatever, but in the evening you are supposed to fend for yourself. So like you are in a MSF house, so there is like a food pool. So you know everybody contributes to it, and then there are cooks, or sometimes whenever you go out, everybody, it's like a Dutch
Yeah.
sharing.
Hey, but I was talking not of this. This is sort of a dearness allowance for the
Yeah.
day.
Yeah.
I was talking of something significant in terms of the time you have spent or the efforts you have
Only
spent.
see, if you have a long-term contract with MSF, it pays you, but it doesn't pay you much.
Okay.
It's very meager amount, like
Right.
some 500-600 euros or something,
Okay.
which is not a
Okay.
very significant amount.
Right. Right. Right.
But yes, if you are committed for a long term, like 3 months, 6 months, for a junior person, yeah, it can go to about 1,000, 1,200 euros, and then it is still not good enough. But if you the kind of experience one gets, at least one can sustain on that.
So you mean to say continuously being in the conflict zone for maybe 3 months, 6 months, 9 months, working there?
Not conflict zone, like not for plastic surgery, but like they have permanent projects in
Okay.
countries like South Sudan, and where they have maternity services and all general surgery services. So all the medical services are provided by MSF. So there these positions are 3 months, 6 months, I mean minimum 6 month positions.
Right.
So for plastic surgeons, usually it is 3 weeks, 6 weeks to 3 weeks. Now from 6 weeks, I have said nothing more than 3 weeks, max 3 weeks coming and going. So anything more, I say I'm
Right.
not going,
So,
because
what are the kind of patients you select and identify and operate on? Because I'm asking this specifically because obviously, when we operate and we come back, there is nobody to take care of the post-operative complications if they happen so, or any specific post-operative care that needs for plastic surgery patients. So, do you specifically identify only those patients who can be managed comfortably?
no, see, I've been on multiple types of missions. So I've been on cleft missions. I have been on post-burn reconstructive surgery missions. Then this general missions like MSF. Then there is something called as a NOMA mission in Nigeria.
Yeah.
These are very so in NOMA mission you have NOMA patients where there is a specific hospital called NOMA Children's Hospital in Sokoto, Nigeria. It is one of the world famous hospitals. If you Google it, you will find it. It's Noma Children's Hospital, Sokoto, where all these children are treated. So there are people who are used to taking care of.
Okay.
So there are physiotherapists and all trained people who are there. Similarly, in Gaza, there are people. The plastic surgery services are good, and especially the physiotherapy services are excellent. Actually, I would say one of the finest physiotherapy services I've seen. There is a very senior physiotherapist called as I think Abu Abid. He's so good. Like I haven't seen any physiotherapist or occupational therapist as good as him. And it has a very good. The MSF has a very nice clinic in Gaza City where all these post-burn
Mhm.
children, because there are a lot of burns in children, especially because of the internally displaced people. Uh, so these patients are taken care of, and what I'm trying to tell you is like the facility in Gaza that has it has a they make what do you call customized pressure garments and
Oh,
customized face mask. So they have a 3D, so they have a machine where they scan the child's face, then they make a 3D mold out of it, and then they make a positive.
I get it. I
So
get it.
they make customized face masks for burns. I haven't seen this
That happens
anywhere.
even in India at many places. Yeah.
Yeah, so like, and there was a BBC documentary on that, uh,
Okay.
uh, regarding that plastic surgery. I mean, the the physiotherapy department. There was a BBC documentary on that, and that man is very sought after. Even this fellow was called during the Ukraine war to help assist all
Okay.
these
Okay.
things.
Talking of Gaza, I've heard previously from you, just I think at Operation Restore or some other place when we were together, about your experience of the tunnels and all those things. So, is
Yeah,
it
you
really
can't
true
put.
what we see in the news? How exciting is it? Is it, or is it terrifying? And in general,
No,
about
no,
your
you,
experiences.
these tunnels are all clandestine stuff. You don't enter, you don't see the tunnel. I mean, you just know the existence that there are tunnels, and it is all hush hush thing. Like, these are I mean, no go areas for a common man, including a common Gazan.
Oh, is it right?
So these, you just know that this happens because many times accidents happen in the tunnel, some
Hmm.
roof collapses, and you end up seeing these patients.
Okay. So that is how you know that they exist.
So I mean, or a fire happened, and then you see casualties because of the tunnel collapse or whatever. But that is all hush hush. Like,
Right.
you're not supposed. I mean, I haven't. You don't see none of the expats who ever go, who have any knowledge about the tunnels. But it is assumed that beneath this road there must be some tunnel. Because they say that, I mean, it was said that the tunnels were about 500 or to about 1,000 kilometers.
Yeah. Yeah. Yeah.
Gaza is just 50 by 10, 50 kilometers by 10 kilometers. That's only that small strip of land.
So everywhere there is a tunnel beneath you, almost.
That's what is understood
Right. Now,
or
coming
assumed
back,
by the Israelis.
yes. Coming back to the original question about the patient selection and patient identification, what patients do you typically avoid operating in these camps?
Depends upon the situation. In camps where the blood is, where blood banking facilities are not available, then you have to be careful there. Especially in initial days in Gadchiroli, we had to be very careful about these things. Or where places where you feel that post-operative care may not be, so
Appropriate.
then you have to time your cases, like all the graft, full thickness grafts and all, and pediatric cases which require a dressing under anesthesia. You schedule them in
Early
the
on.
first half of your mission,
Get
so
that.
that you do at least one or two post graft dressing yourself under
Yeah.
anesthesia, especially in children. So
Yes.
that you have to be careful. And yeah, flap division and all, there are usually medical officers, they know how to do it. But then
Hmm.
you have to assess, and the most important thing going on a mission is the KISS principle: keep it simple,
And safe.
yeah, and safe. That's
Right.
the most
Right.
important, and you because a small complication can completely
Ruin the reconstruction.
yeah, not reconstruction, the whole the mission can be jeopardized.
I know.
So it is better to be safe than sorry.
Right.
So even sometimes, there is a pressure on you to do, like, but at that point of time, I mean, you know that you could have done this back home,
Yes.
but you have to be sometimes, I mean, really tough and say no, sorry, I mean,
I get
I
that.
wouldn't want to do this.
Right. So in
Feel
your
very sorry about that,
hmm,
because you could have done this. But since blood banking facilities are not there, maybe anesthesia facilities are not there, proper. So
Right.
I mean, not everywhere, but you have to be very choosy about these things.
I get it. So, in all these years of your volunteering across the globe, you must have obviously made a lot of friends. So, some interesting stories about making friends in these conflict zones. These friendships, like making friends over alcohol, I believe, tend to last longer and are more stronger.
Unfortunately, no alcohol is allowed in Gaza. You have to make friends over coffee and shisha. That. But yes, other places, sure. In Nigeria, it was like, every evening you used to come back and had a glass of beer,
Right.
to and put our foot up. So like it was like Sachat Gharat,
Mm, 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 mm.
because it was said that you have to reach your base
Yeah.
before the sunset. So
Right.
that was so we had to start very early. So our surgeries used to start at 7:30, and come what may, we had to reach our house, yeah, from the hospital. It used to take about 20-25 minutes, but before 6:30 we had to reach the MSF house.
Mm, mm.
So where everybody was, they rent a couple of bungalows, and then they have a fencing around it. So that's called as an MSF house, where,
Okay.
and then, yeah, then you talk, you make friends, your colleagues from various countries. uh,
Right.
Same is with MSF. When you sit for dinner together on the dinner table, you might find a French person, a British, a Brazilian, an American, Italian. So like, they're on a mission. You find multiple people of multiple nationalities, and
Mm.
they become your, I mean, good friends. So like, whenever you meet again, or like, I met friends yeah, yeah, in Amman. There was a person. He was a hospital administrator. So when I went to Paris, I just wrote an email. This guy was not very well versed in English.
Okay.
His wife was an investment banker, so actually she used to read his mail and reply to the mail. So I just said that I'm coming to Paris. So he said, no problem, I'll come and pick you up. So he along with his wife picked me up at the I mean, I traveled by Eurorail from Berlin to Gardenu station, and there he picked me up, and then toured. Took me around Paris in the evening. Then took me to the Versailles Palace. Then took me to his house, and we had a dinner. And actually, he dropped me at the hotel at 1 o'clock in the night. So
Mm.
from about 12 noon till about for 12 to 13 hours, he was just entertaining me,
Yeah, yeah.
just because we were working together and staying together in that MSF house.
Right.
Similar kind of friendships, I mean, there are so many, I can say. I have
Yeah.
another American friend who is a trauma surgeon. His name is uh, Dr. James Watkins. Is a Harvard alumni, and he's actually the team doctor for the US uh, Winter Olympics skiing team. So so
Right.
you get to know such people.
I know. And you also get to savor the alcohol across the globe.
Yes, yes, of course.
Various drinks across the globe.
Yes, yes, yes.
So, what drives you, or what motivates you to keep on going year after year? Uh, because I think doing consistency is very difficult thing to achieve in any field. Doing this year after year for a period of 4 to 6 weeks, almost every year. So, what drives you to do this? Because there is no financial reward as such.
No,
What
there is no
you
actually,
know,
you are at a loss. I mean, you are not there for 6 weeks in your private practice.
you lose that money.
You lose that money. I mean, I get called. The first thing somebody, it's a joke in Kolhapur. Like, anybody who calls me, he will say in Marathi, "Arey Mahesh, tu ka India ta iska?"
Right.
Then the next question is, "मग कोल्हापुरात आहेस का?" Because then I'll be at some conference or here. So like, this is become a joke now. Like, say anybody, "Oh, so to India आहेस का?" As if I'm all the time staying abroad. But then this happens to you, it does affect your practice. But
Obviously, obviously.
uh, you know it is volunteering, and this is a very addictive thing. And addictive means, by WHO definition, you get withdrawal symptoms.
Mm,
If you don't go on missions, you really yearn to go on missions. So, like, it is something you miss.
right.
And then sometimes you'd always get calls, because that you are a senior volunteer. So, like, I had said ki I was not going to go to Gaza anymore, but I still got called, and they said, no, 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 you are going to come. Actually, we had this time when I went to Gaza, we had a lot of plans made to start the plastic surgery residency program. Myself, along with Dr. Chanjeev Singh.
At Gaza.
Yeah, in Gaza, we wanted to start. We had met the Palestinian Medical Council chief and the health minister, who's a pediatrician, and this
Oh,
Palestinian Medical Council chief is an ophthalmic surgeon. So we had made out a plan. We had given them the curriculums of MCH and how to start, so that there will be a, because there were in Al Shifa hospital, they had a urology program, and they had a neurosurgery program
already working.
already working, residency program I'm talking about. So
Yeah.
they wanted to start the plastic surgery program, and uh, they had asked us to be on that. Look, so I was asked to come twice a year. Chanji was going to come 4 times a year, and every month. And this is, I came back in mid August, and the 7th of October happened, and rest is history.
Oh.
So, so I don't know.
You have been there just recently before all this happened.
Yeah, yeah. And again, in 2014 also, I escaped the war by just 2 days.
Oh.
Uh, you know, uh, it was, I think, July, and there was a rumor that the two Israeli kids were abducted, and they had been taken to Gaza from West Bank. So, 2014, the first time after Gaza, Israel left Gaza, they entered Gaza in 2014, and we were aware that these were going on, because I was staying. I mean, we could hear the jets and the drones flying overhead
Mm,
last week of my mission, and I had not even reached India. I was in Istanbul for a couple of days while coming on my way back, and I came to know that the Israelis had invaded Gaza, and there was a lot of destruction in 2014 itself.
okay.
But from 2014 to 2023, when I went, there were a lot of developments in Gaza, and Gaza was looking actually spanking and really good. It's like a Mediterranean town, you understand? Like,
Okay.
it's Mediterranean Sea, and it's wonderful, except that there is no alcohol, and
Mm,
there are but very good hotels and everything, but it is not a tourist place.
yeah. Yeah.
It is not a tourist place. It's not meant for tourists.
Right. Right. So, on a personal level, being a part of so many missions, how has this contributed to your overall? I mean, as in person, in professional life, how has this helped you?
See, in professional life, you sometimes, like, I mean, I went to I mean, for the Noma missions. I had never seen or treated
Roma?
any Noma, but I mean, I learned few things, because there were other colleagues with me. There was another American. When I went, there was a senior American plastic surgeon. Yeah, he mentored me into doing things, and then the next time, then I became the team leader, and I realized his precious advice, as to what to do and what not to do. And
Mm,
when I was asking something, whether I wanted to do something a little more daring or a more dicey flap, and this man used to stop me, and then I realized why he was saying so. Like, because once you become responsible, you realize what are the risks
I know.
involved. So, or when some of your junior or the other person is trying to take that risk, so that also happens. uh, Sometimes you also, you know I mean, on these missions, you sometimes have to prove yourself also. I've seen this on many missions, especially uh, you know you're not looked down upon, but
Hmm.
you understand my point. It is
If you're
my
not doing a particular kind of work, maybe you're too scared or that type,
no, no,
that
no,
type
not
of.
not like that. As a plastic surgeon, also, like, I mean, I'll tell you a story. Uh, in Sokoto, during the mission, I was the team leader, and there was a American anesthesiologist from Seattle, and he was a little, kind of a brash and a little cocky, and every time, like, he was a little stickler for, like, this is to be done, this is like this is like this. I mean, I said, "Nahi boss," and so, we used to have some frictions for about 4 or 5 days, and not that he used to look down upon me, but probably, I mean, ye India se hai, I mean,
Hmm.
not up to American standards, kind of. And then I was a team leader, so somehow it didn't, I mean, go down well with him.
Yeah, yeah,
But I was a very senior MSF volunteer, so, like, I'd been on multiple MSF missions. So then on one day, I did a very complex reconstruction on a child with a complex, I mean, composite defect of the cheek and the lateral wall of nose. I raised a huge mustardy flap, bilobe flap, and I took the lower eyelid along with the mustardy flap, then covered that cheek hole and used the eyelid, I mean, reconstructed the eyelid and used the
yeah.
eyelid to reconstruct the ala, which was quite a very, novel kind of a thing. Even
Hmm.
describing it is a little, but
Yeah.
I mean, when I explained that plan to him, he was just aghast. He said, "What are you doing?" I said, "Don't worry, I know what I'm doing." And after the execution was done, I mean, he realized that, I mean, yeah, this guy is.
Right.
So, after that, we were quite good friends. Like, we had beer together and all.
Right.
So till that time, there was some kind of frostiness between us. So it happens. It happens many times. I've seen on this on multiple missions, not MSF but other missions, cleft
Right.
missions, especially cleft missions.
So, talking of all these things, wherein you've already briefly touched upon this, but just to go into more details, how would you rate the infrastructure of India versus infrastructure of all these other countries in general? Where do we stand? Are we much better, or we have still to achieve a lot more? I am talking obviously of the rural conditions, because our tertiary care centers are at par, and we do have a lot of medical tourism coming in,
Yes,
people
yes,
coming
yes.
in across the globe. But I am talking of the rural healthcare in India
In
versus
India, you mean?
versus the healthcare across the globe.
See, because you rarely operate in a very shanty kind of a place.
Yeah.
Usually, when so you don't know what. So usually, you are hospital. Generally, you are, whenever you are operating, you are operating in a district hospital
Yes.
of that country. So in Uganda or in Kenya or in Nigeria, they're decent, because usually what happens is African countries get a lot of
Funding.
equipment in donation, because a lot of teams come and visit them.
Hmm.
You understand? So there are a lot of cleft teams from Europe who come with their residents to operate. So usually what they do is, uh, all their equipment and everything they leave back and go.
Yeah,
So sometimes you might find
I get that.
far better quality instruments over there, but nobody to use them.
So
So
effectively, we are better. I would say we at least have people to use.
yeah, yeah. But like, when we went to, I mean, when we started in Gadchiroli, we, from a very very modest setting, today now the Gadchiroli setup is really good.
Yeah.
Over a period of these 15-20 years, the operation theater and all have become really top class now, and so there is nothing to be. But we have seen the development over the years, due to various grants from various agencies.
Hmm.
So, the place like Gadchiroli, I've seen the transformation of that hospital over the years. So similarly, over there also, like, district hospitals are as good or as bad as our district hospitals. similar kind of so
Okay.
nothing except that when I said that there's this Al Shifa hospital in Gaza was really a top notch hospital. I mean, it is better than 95% of public hospitals in the country. It was that good and well equipped.
Mhm. So now there are many young plastic surgeons, budding plastic surgeons, who probably are wanting to do volunteering, are interested in attending surgical camps across the globe, but who are not aware of the track, what to follow, how to venture into this. So how do they go about it? What advice would you give them, and how do they proceed?
No, you should, there are multiple camps arranged by multiple organizations. You should start going with them. Plus, if you are in touch with the local Rotary clubs, the Rotary Foundation has this program of this Rotary Intercontinental Mission.
Okay.
Yeah, the Rotary, the past Rotary International President, Dr. Raja Sabu, who's one of the Rotary International Presidents. There are only two or three Rotary International Presidents from India.
India.
So this Dr. Sabu was one of them, and it is his pet project, wherein multiple teams from India have gone to multiple African countries. So so the doctors from India go, and there is a matching grant kind of a program which happens. So you get associated with them. If you want to work for MSF, then you can go to the MSF website and register yourself as a volunteer. Or there are multiple other organizations where you can apply and be a volunteer, and then whenever the opportunity comes, uh, I
So
mean,
is it that simple that you go on a website and you just enroll yourself, or do they need some kind of recommendation, some sort of an experience? Uh,
yeah,
bit
experience.
of-
Yeah, yeah, they ask for it. They ask for it. Like when I went for the MSF, they asked for references. They asked for your, obviously I was pretty experienced by that time,
Hmm.
but that interview process was 2 days. Like there is a psychological interview, which is a very interesting thing.
Acha.
They give you very different scenarios, and how you behave, because they want people with very because in a difficult country, a situation can be very fluid,
Yes.
and these kind of things, like there are a lot of psychological kind of tests which were conducted
Oh,
during our interview, before I was selected, and even post. I mean, you will be surprised. Like whenever you go on MSF mission, uh, once you come back from mission, there is a psychological evaluation survey.
is it?
So the psychologist from Amsterdam will take your interview for about half an hour.
Oh,
What are your experiences? Is there any post-traumatic stress? And what are the kind of experiences like? So these kind of things are, they are very organized about, especially the MSF.
right.
If you come from these areas, like, so whether any experience has affected you positively or negatively. So these kind of things are there usually. Even as a team leader, when I went, I had to have this questionnaire pre mission.
Okay.
You have pre-mission counseling. Multiple people counsel you
Hmm.
regarding. There is a psychological counseling before you go to mission. Previously, it used to happen like I had to travel to Amsterdam head office to have these, but nowadays post COVID, all
It's
these things is
online.
happening on Zoom.
So apart from this MSF, what are the other sort of organizations, Doctors
Like
Without
there is a, for
Borders?
cleft you have something called as Smile Asia, or Mission Smile, or Operation Smile. I was part of the Operation Smile till
These
few
are
years.
focused only on clefts. So you go there and operate only clefts.
Yes, yeah, these are cleft specific missions. Operation Smile also had the burn missions, which we had three burn missions in National Burn Center, and after that they withdrew the support. But thanks to Sunil Keshwani and his team and Rotarians, we still continued. Now there are about 25, 26 Operation Restore camps. The
Yeah.
first three were done by the Operation Smile, but
Right.
we continued with that. So I'm still, as you know, I'm
Yeah.
still a part of that Operation Restore,
You
and
are a
so
part of,
that's
I think, every Operation Restore you have been a part of since the beginning.
yeah, maybe couple of Operation Restores I might have missed, but most of them I yeah, because Sunil is a great friend of mine, and
Right.
we will. I love to go for those missions because I learn from people like you. So it's like second hand learning from Dr. Yogesh Bhatt.
Yes.
Through you, I am learning, and then
Even
I
that
met
is,
Yogesh
yeah, even
Bhatt.
I get to meet sir when Bhatt sir comes and you and all other. It is a very interesting and inspiring time out there. You get to
Yes,
interact with so many people out
you
there.
learn from your colleagues. Like
Yeah.
it's a wonderful. I mean, I relish going to the Operation Restore missions.
Right.
It's fun time.
Yeah. So, sir, so it was wonderful talking with you and listening to your experiences about all this surgical volunteering, especially in the conflict zones. And these are some things which I believe none of us have heard before. We have heard you talk, but not in this depth about the actual problems, the actual abductions, things that happen, and obviously bonding with friends. So, to conclude, I would like to ask just one question. What are the life lessons that you have learned that you would like to share with us? Life lessons doing these camps, being a part of these camps.
Yeah. So before that, can I just add something?
Obviously, sir.
See, most of the missions I've gone in, one of the most organized missions are these Operation Smile missions.
Okay.
They are so well organized. Like they have team, pediatric anesthetists, then intensivists, then the post-op nurses and everything. And before conducting the mission, before the start of the mission, they have the code. Everybody is there around, so that, like, everybody knows what is happening, how to behave during an emergency.
Hmm.
What happens is, in a international mission, especially in optimal mission, if you see the drug tray, you might have the adrenaline made in France, the atropine made in UK,
Yeah, yeah, yeah.
some other drug in. So then you don't know, because you are used to your thing.
Yes.
All these emergency drugs are passed down, so everybody sees them, like how adrenaline looks, because
Exactly.
it
Our adrenaline is going to be different. Their adrenaline might be red in color, brown in color,
so
deep brown.
exactly, so all these things, and this is a very organized way. So if you've been on this Operation Smile mission, you get to really, what I say is, uh, appreciate how meticulous planning
Hmm.
a mission should be done, and that is how, so everything is really done very well, and the nurses who are there are very, very efficient. And the similar things I have seen now. The Smile Asia is practically a clone of Operation Smile. So these are the kind of, the way that their protocols and the way they manage things, their record keeping is
Hmm.
fabulous. Like, so there is something to learn from them. So that's how I forgot your question, what you said.
The question was, sir, what are the life lessons you learned? What you would like to share with us?
Yeah, I just
Obviously, you must have learned something
sure, I yeah, yeah, yeah.
beyond the life, beyond the knife, about life.
Yeah, couple of things, like, uh, I just didn't mention about my working in tent. I worked in a tent for 1 month, by the way.
Oh.
So in Gaza, where, in Khan Yunus, there was no hospital facilities. I worked in a tent. Now these tents are, inflatable air conditioned tents, uh, and these tents can be erected within 24 hours. They are packed in a container, and
Hmm.
they're dropped anywhere within 24. I mean, so you can have a functional hospital, including an operation theater, operational within 24 oblique 36 hours anywhere on the globe
Oh.
during emergencies. So MSF had erected similar kind of hospital tent in Nepal or in Haiti, or, this is like, and they have an operational center in France, and the logistical manager just on the computer has to instruct, like, you carry this container, everything is organized, and within an hour they can ship the whole thing. So that is how well they are organized.
Mm-hmm.
So that is again the what should I say?
Something interesting and unheard
Yeah,
of.
yeah.
Yeah.
And another couple of things is like I mean, big names I met is like I met Dr. Don Lalonde uh, in 2008, before he became famous for his wide awake hand surgery. Actually, he showed me. I still have his videos on wide awake hand surgery. And
Okay.
then we did quite a few. I mean, I was not very sure about the articochea pharyngoplasty.
Okay.
So actually he demonstrated me, and me and him did a couple of, so did a couple of I was not very I had not done articochia as I was not very convinced about this articochia, but he
Mhm.
actually showed me how the sphincter works and all those things. And then so we had a good time. Samely in Gaza, I met Dr. Christoph Oberlin 3 4
Oh,
times. With a great man. He has trained so many surgeons in hand and microvascular surgery
right.
in Gaza and in Africa. So he has come to Gaza maybe 20 times.
Oh,
So Dr. Christoph Oberlin is a very very popular person in Gaza. So that way, you know now you mentioned about how it what volunteering does to you. I
exactly.
just had enumerated few points. Like, it gives you an opportunity to contribute to the society in a very meaningful way. It's a very satisfying and addictive experience. One learns a lot on these missions. How to run things, like, things don't work. Suppose a cautery doesn't work, we are
Mm.
used to working without it. Or uh, power cut. I mean, power cuts happen.
How to adapt.
So these are not, I mean, we are used to all these things. Somehow the Western people are not used to all these things not working.
Mm.
So things not working is a norm in our
Yeah,
yes. So
we
like,
know. Okay, we are ready for that.
so that we know how to manage the jugaad. So we are that way, okay, theek hai. I mean, so many times it has happened that some surgeon's cautery is not working, and then that scrub nurse is Dr. Prabhu. It seems you don't seem to use these diathermy very much. So is it okay if we take your diathermy? And I say, okay, no problem. Anyway, I don't use it much, especially for clefts. I rarely use a diathermy. Then they take that. So like, and then, I mean, we are used to it. Like, there's nothing new about it.
Yeah, yeah.
Other thing is, interaction with local enriches our experience. You make very good friends, and it recharges one's batteries. Secondly, one learns to look at life out of the box. It's completely like, you've always been in your own circle.
In our own comfort zone, we are always
Yeah,
there.
so you meet various people of various different cultures, and and then you become the friends. And it is something that one can tell your children or grandchildren very proudly. And I always say that one gets more in return than one gives. You learn a lot on these missions, even from the local surgeons. I learned from in Kenya. It so happened that they had the Zimmer measures, and they had finished all the derma carriers of 1:3 ratio, 1:3, and 1:1.5. And the only derma carriers which were available were 1:6. And they had devised a way of turning that 1:6 ka derma carrier, so that it could make a 1:3 kind of a thing. And that was a new thing I learned. This
Mm.
cut the derma carrier in a very funny way, and used to feed the graft differently, so that even though it was a derma carrier which used to make a 1:6 mesh, ultimately it used to mesh, because 1:6 mesh is useless. I mean, you can't put it unless you have a cadaveric skin
Mm.
working. So that is what I learned from the. So people, just like us, they also do the jugad. Uh,
Right.
so that is there, and there are a lot many untangible benefits you go when you go on the mission, and one makes friends for a lifetime. That's the most important thing. Like, you make lifelong friends. I think that's the most satisfying thing on this mission, and you feel good. Like, I feel very good about it, and I will keep doing it as long as I am fit and
Yeah, as
able
long
to.
as your health permits. So
Yes,
here is hoping that you continue these missions till at least till the age of 70, 75, I would say, because you are pretty fit right now.
hopefully, yes.
So thanks a lot, sir. Thank you for joining us for this session of Candid Conversations. And I'm sure any younger colleagues who are interested can approach you, and you will be able to guide them and streamline their journey in the field of medical volunteering and these surgical missions across the globe as well as in India.
Yeah, I would advise all the youngsters, like, you start it young, so that you inculcate this social responsibility. It is a kind of a social responsibility. Like, people came to India, you know but now, 70 years, 75 years post independence, we
Yeah,
as a plastic surgical body, we have enriched ourselves, and now we can definitely say that we can contribute to the body of, I mean,
I get that. I get that.
you get my point. So, like,
Yeah, yeah.
we
Now
can
it is our turn to
give
contribute.
back to the world like what we received.
Yes, right.
And
Okay.
actually, our model is far better. Like, I keep telling my African friends that don't look to the West, look to India,
Yes,
because we have reinvented the wheel,
right.
because we were denied technology till, we were liberated. Like, I mean, I passed my MCH in 1991. So, like, I passed my plastic surgery before the liberalization happened, when
Mm,
a telephone used to take 9 years, and now you get 3 SIM cards a day delivered at your house. So, from that days to this day, like, we've seen how India has progressed. So, I am, bridging both the generations, like, from this stage of deprivation to where now you get anything you want, any new technology which is available anywhere in the world, the next moment,
it
it
is
is in
there.
your hands.
Yeah,
So, like, that's why, I mean, we are in a good position to help, our colleagues in uh, developing countries.
right. Yes. So it was a pleasure talking to you, sir, and thank you all for joining us. I think we will conclude our session. Thank you, sir. Thanks again.
Thank you, Nikhil. Thank you very much. Nice talking to you very much. Thank you very
Same here,
much.
sir. Thank you.